right, beautiful. I'm going to give it a couple minutes, and then we'll try to start very much on time so that my goal is to be able to go until and I'm very open to answering questions as I'm going along because a lot of times, we have questions, burning questions that come up as I'm doing the presentation. So please feel free to ask, and I'm happy to pause where I'm at and answer any questions that we have that would be coming up. So just to tell everybody a little bit about myself as we wait for some folks to come in here. I'm a licensed psychologist who is also a neuroscientist. And my entryway into being a neuroscientist actually came from a postdoctoral program that I did about 11 years ago, where I thought that as a psychologist, I wanted to go into the world of prescribing medications because in the state of California, in the next couple of years, we should be able to prescribe medications. So basically, I had a 2.5-year program that was a postdoctoral program that was getting me ready to be able to put a patient on this medication. And then if you have side effects from that, then put them on this. And then if you have a side effect from that, then put them on this. So needless to say, I learned a lot, which was fantastic. I was able to really learn a lot in the program and came away with the knowledge base that there are other ways in which we can regulate the brain. And so that's how I came into the world of neurofeedback and just really began to utilize neurofeedback as a way of stabilizing the brain. That's in addition to, some of my patients will be on medication. So it's not like I completely reject that modality, but I think that there's so much more that we can do with the brain. And then as I kind of go through my workshop, you will hear me talk a lot about my biases. So I think some of you that know me well probably have a sense of what could be coming up next here. So I'm an integrative psychologist. So that degree actually made me make a U-turn and become much more integrative in my perspective. And I really like the idea of vulnerability. Okay, I'm going to change my people. I want to change everybody at the top. How do I? There we go. Yeah, that'll be better because then I can see folks here. So I think what's occurred. So it's funny because I've been reading this fantastic book about this anxious generation, and one of the things we're talking about is really parenting and what's occurred for us with parenting. And truly, if we look at parenting in the 50s and 60s, we were what we call free range kids. So in other words, children were being just raised like organically, and parents seem to know what it is that you have in terms of how you parent, and that there was a lot of free play in childhood and free play where didn't have parents hovering. So it's more as we transition into the 70s and the 80s that we found these groups of people that became kind of like our parenting experts. And so then in so many ways as parents, part of what we've done is we've kind of abdicated our intuition and our gut and our hunch about what we want to do with parenting over to these folks who seem to know a lot more about raising our own children than we seem to know. So I do have a bias about how 2010, 2012, once the screens have come in, I'm seeing a big change in the levels of anxiety. And in some ways, we've become, when I say parenting has lost its priority, I'm really kind of thinking about parenting, what's going on in the digital world for our kids. So we overparent in the real world and we underparent in the digital world. So there's a lot that goes on in that digital world that I would like us to become more connected with. And then, there's this whole level of this culture of disrespect that's begun to show up. And I would love for us to be able to get to a place where we move much more into civility and the golden rule and a lot of those kinds of things. So that's like a very big bias of mine. And I like to have all of us become aware about the impact of gaming and screens on our teens, because I think that's really making a huge impact. Let's be real. I think that, when we go into any process where we're shame-based, we tend to really struggle. So we want to, particularly this whole topic of vaping, it's very important that we can go into it with an idea of like that open-mindedness and recognizing that part of what we want to be able to do is not have any judgment, because there's a lot of areas that our kids are going to struggle in. And we as parents, we want to be able to honor failure in them. And at the same time, we also want to honor failure in ourselves, because that's just very much a part of raising a child. And whether you were raising a child in the 50s or the 60s or the 70s or the 80s, and particularly now with the social media world, I see parenting very much like surfing. At one moment you'll have the calm waters, and before that, there's like all this turbulence and these big waves and all of that. And I think it's very complicated. So I have a daughter who's 32 and a son who's just turned 26. And so I have a Gen Z and a millennial. So I see in my own home the difference that's there with a millennial who had a flip phone, who didn't have a smartphone until way past her adolescence, and then a millennial, and then a Gen Z who got a smartphone, I think when he was in 8th grade or 9th grade or something like that. So I see the difference with both my children. Haven't obviously have a potty mouth, as some of you might know. So if a word comes out, I apologize in advance. It might be kind of colorful. So please accept my apology in advance. So I'm going to talk about, so what I really want to talk about are the health risks associated with vaping. Most of us know many of these, but I just kind of like to touch them a little bit, just because it's important for us as we talk to our teens and our young adults that we can speak about some of these things, because they're going to be flooded with a lot of misinformation. And because they're going to receive misinformation, it's important for us to have the appropriate information. And the reasons why they vape, impact on brain development in adolescence, effective strategies for quitting vaping, and support systems that we can create, and resources. And oh my God, I was blown away by the number of resources that we have available for vaping. So just know that there's a lot that we can do, and I don't want everybody to feel like they're stuck with it. So if anybody wants to like unmute themselves, because we are a small group, so if you want to unmute yourself and tell me what the struggles are that you've had with vaping, what brings you to this seminar, I'd love to hear from a couple of you. And you can feel free to unmute yourself. Anybody?
Well, I'll jump in. I don't know my daughter's 23 now, and I'm not sure what age she started vaping, but she's now been doing it all through probably high school, and she wants to quit, but she's having a hard time quitting.
Yes.
So
Yes.
that's when I thought, oh, well, maybe I can learn something to help her, get off.
Beautiful.
So
Beautiful. That little tiny piece right there, let's say that she wants to quit, you will feel so hopeful by the time we get done with this webinar, and you'll have some very specific strategies that you'll be able to help your child with, because ultimately that's what we want. Even if our children show the slightest inkling of wanting to quit, that is where we can do a lot with it. And then I'll also talk about, if they don't want to quit, kind of like what kinds of things to be doing and how to be addressing it. And the other big piece that I'm really going to talk about will be this whole part where many parents will have kids who are in middle school, where their friends may be vaping around them and they're starting to vape, or you may have suspicion that you might have a child who is vaping and maybe possibly thinking about moving towards vaping. And what you'll have is you'll have an ability, you'll have some skill sets on how to have these open conversations with your child about vaping. So e-cigarette use among young people is at epidemic levels. Over 2.5 million middle and high school students use e-cigarettes, with nearly 50% of high schoolers who do so daily. Okay, so it is extensive. It's very high. Now, 1997, we saw this big dip that happened with cigarette smoking. So we were like, oh, excited. Oh my goodness. So smoking rates are going down. But what ended up happening is the tobacco industry got smart and they figured out a way to create a product that was going to be the next generation that they get addicted to nicotine. So folks who are in the business of nicotine were innovating behind the scenes for them to create products that would be appealing. And then the way the vapes were created, they had a lot of technology to it where you couldn't smell. And then they started enhancing flavors. So it's really interesting. The other day, I was asking one of my patients, she's in seventh grade. Yeah, she's in seventh grade. So they had like a anti-vaping webinar at school, at her middle school. And so I was asking, I'm like, so what kinds of things did they cover? And the week before and the week before that, she has been fussing about how her mom is vaping and how upset she is that her mom is vaping and she's trying to get her mom to stop vaping. Okay. So they have this anti-vaping seminar in their school. And then she tells me, she comes in and she's like, actually, the the fact that they were talking so much about these candy flavors and these flavors of vaping. So vaping actually started appealing to me because they were talking about, oh my God, and you know, Dr. K, how much I love my candy. I can never get away from my sugar. So I thought, wow, if these are the delicious flavors they have in vaping. So even the people who are doing the anti-vaping webinars are not realizing that these little things that they're saying to kiddos are actually planting the ideas in their mind about vaping, right? So we remember in the 80s, we used to have that whole just say no drug. Remember the just say no movement about drugs that we had in schools? Okay. Over the years, there are so many patients I've worked with who have said that when we had those just say no seminars about not doing drugs and they told us about drugs, that's the first time I actually started learning about drugs was in school. So some of our anti-vaping webinars, if they're putting too much emphasis on the flavor of the vapes, what that's doing is it's enticing kids towards that. So that's something we want. When as parents we have discussions with our kiddos, we really want to trivialize that part of it and really talk about what the nicotine is going to be doing to your lungs and really kind of come from that perspective. So I come into this world with a lot of personal experience, as I always do with my son laughs because he and my daughter joke about how he's my patient number one because he's the reason why I'm in the world of neurofeedback. And he's my firsthand knowledge for me about vaping because the first time, so 81% of kids who start vaping will vape because of anxiety or depression or some mental health issues or the social peer pressure. The first time he vaped was freshman year of college at Coachella. All his friends were vaping, and he's like, Mom, they were all vaping. And they're like, oh, it's nothing, just try it, enjoy it. And then he's like, you get this head rush. And then so he tried it a little bit here and there. But then as soon as he bought his first vape is when he knew he got addicted with it. So he had been trying to quit vaping probably about 3 times before he was fully able to quit. And it's been about a year and a half to 2 years that he has quit completely, but he could feel it. So I come from a place of non-judgment about it, and just because I have talked with kiddos about vaping doesn't necessarily mean that in my own home I'm immune to that. So I just really want everybody to know that this is swimming in the waters, and we all struggle with it. So there's a way we can kind of get through it together. So in 2023, okay, I'm going to do this. In 2023, 21.6% of California high school respondents had ever used. So that means 1 in 5. This is last year, guys. 1 in 5 California high school students have used tobacco products. Vapes were the most commonly used products. And you ever use vape was 18.3% among high school. So we're looking at 1 out of 5 kids overall high school respondents that reported that it's very easy for them to obtain vapes. For people who got the vapes, 50% reported that it was easy to access them from a store. These are our high schoolers. These are our ninth graders, 10th graders, 11th graders. 67% said it was easy access from the internet, and 71% said that it was easy to access them from someone else. So these are high percentages. So we may think that we are somehow controlling it, but look at all the sources from which they're getting their vapes. And for cigarettes, 37%, so a little over one third, reported it was easier to access them from a store. 58%, so almost 60% said it was easy for them to access from the internet cigarettes. These are actual cigarettes. And 60% said that it was easy to access them from someone else. So we have 2.1 million middle and high school students reporting that they're using e-cigs. So it's pretty substantial. Pretty substantial. So we know that some of the health risks are respiratory issues. So one of the biggest things, so I asked my son, we were talking the other day, and I'm like, what is it that made you like decide to stop eventually? And he's like, Mom, I could feel it. I would be going, because he lived in San Francisco at the time. I'd be going up the hill and I would get winded. And so he knew that his body was going through a lot of damage. And so some of the biggest health risks are because the intensity, the amount of nicotine in the vapes is so strong. Like one of the vaping capsules contains 20 cigarettes, and many of our kids will go through 2 of those a day. So that means they're smoking what's equivalent to 40 cigarettes a day. That's how much they become dependent on the nicotine. We have heart disease, cardiovascular risks. There's a potential for addictions, and we have mental health implications as well. So what happens with vaping is kids will initially start to vape because they're anxious, and then they get more anxious as they vape. So it's like a circular thing that happens for them, and it really affects cognitive function and impairment, and affects concentration and focus significantly. The part that we want to be super kind of like aware of is that what vaping does is it increases the risk of them experimenting with other substances and can lead to other substance abuse issues. So we want to be really aware of that, right? So some of the reasons why teens start to vape, the number one reason, majority of them will say, will be peer pressure and social influence, wanting to fit in, wanting to be cool, wanting to be accepted. So vaping is seen as a way to connect with peers. It's kind of like you're in the cool in group, right? And be a part of a social group. And if everybody around you is vaping, chances are it's only going to be a matter of time before your kid will start to vape, right? And there's a social media influence. Vaping is portrayed in a very positive light on social media platforms. And initially, it functions as a stress relief and coping mechanism. And so that would be the reason why they'll continue to vape. And then also, they're emulating adult behavior. And teens, we know, like to do that. So the reasons, the big reasons are really peer pressure, social media influence, and emulating adults. And then we know that the negative consequences are they're going to develop dependencies, they're going to develop addictions. And I'll talk a little bit about what is it that crosses your kid over into the addiction category. Just because somebody's using a vape and they can like use it. And like I have a patient who, oh my God, we've had such success yesterday. She would always have her vape in her pocket. Okay, we've been gently talking about vaping because I want to develop that readiness for her to quit. And what we do is she ends up obviously, a whole hour that she goes without vaping. And so a few weeks ago, a couple months ago, I'd asked her, I said, well, what would it feel like if you left your vape in the car? Just leave it in the car. You still have it with you, but you leave it in the car. So yesterday she came in and she was like freaked out about the idea of leaving that vape in the car because that's how addicted she is to it, that she needs to touch it. People who vape, you'll notice that they'll be needing to touch their vape all the time, and they'll be needing to feel it in their pocket and everything like that. So we know that there's a dependency factor, there's an addiction factor, and nicotine is one of those drugs where you need more and more because the withdrawals with nicotine come in very, very quickly. And the withdrawals are really intense. There's a lot of irritability, anxiety, you cannot concentrate. So the reason why relapse rates are so high with smokers is because the discomfort of the withdrawal is so strong that they will just give in and vape again. And we've got to have empathy for that. We really have to have empathy for that. It harms the pathways for attention and learning. Nicotine, because remember that age between 12 and 24 is such a critical age for the brain to be in its state of like the most immense, beautiful growth that we'll have going on for the brain. So what we want to do is we want to give the brain the most optimum growth we can do. But what nicotine does is it prunes aspects of the brain, like pathways of the brain. And what we've found is that kids who vape drop their IQ points by about 8 to 9 IQ points. That's how much of a cognitive decline that they get with vaping. So they tend to lose interest in studying because the addicted brain is now just primed for that compulsion and the perseveration. Okay, when can I take my next hit? When can I take my next hit? So it's interesting that today I was at the hospital. I went to see my doctor, and I was walking back from my doctor's office to get my car, and I was walking next to one of the guys who had taken my car to park it in the valet, and out of the corner of my eye in the back over there, I'd seen him take a drag, and then I just because I chatted with him yesterday, and I was talking to him today, and I'm like, so question for you. I said, I'm going to do this webinar tonight about vaping. Tell me what got you started, or so we just had an open conversation, and he says, I can see what it's doing to my body. And he's like, I only vape when I'm at work because this job is very stressful. And he's like, when I'm at home in the evenings, when I'm doing other things, he's like, I don't even vape at all. I'm like, wow. So it was really interesting just to have like an open, non-judgmental conversation about that. And I think any of us can sort of do that and have curiosity about it, because I think if we have curiosity, we're not coming from a judgmental place. So this compulsion and perseveration is, I have to do this thing and I cannot stop thinking about it. Have to do it, and I cannot stop thinking about it, right? So the reward center gets hit. Whoa, holy smokes, this is great. Come on, let's do it again. When you go down, up and down those roller coaster rides, that's exactly the dopamine hit that the person is getting. And what nicotine does is it makes it hard for a person to think clearly, to start to struggle with delaying impulses, planning, judgment, regulating emotions, and we see higher rates of depression. And see if you're able to get them to articulate how they feel like their brain function is different compared to how since they started vaping. What you want to do as a parent when you have sort of like non-judgmental conversations with your teens about this is to think in the back of your mind to create that readiness for change, which means that you'll have a kid that may say, oh, mom, just back off. It just makes me feel better. I just know, stop nagging me, don't go there. I'm not going to. And you say, hun, I'm not going to ask you to stop vaping. But what I'd be intrigued about is, what is it? What is it that you feel? What goes on for you? How do you feel after? I'm just asking a few questions, because by asking those questions, what you're doing is you're teaching them to become mindful and become a little bit aware about what's going on in their brain with what makes them want to go for the vape. I was very conscious about not putting tons of pictures of what the actual vapes look like. So I need you guys to go on truthinitiative.org. That's a really good website. I have it as a resource at the bottom over here. And what I'll be doing is I'll be sending you all copies of my PowerPoint as well. So you'll have all the resources in there. But it's very important that you recognize that some of the vapes right now look like our memory sticks. I mean, the vapes are being disguised in all kinds of ways. So you want to go on some of these websites and see the ways in which the different vapes are because part of what the vaping industry wants to do is make sure that they produce products that the kids can hide from their parents, that they're invested in that. So they'll be very creative with the kinds of products they're going to be creating, right? So I need parents to be aware that at some point you might think, oh, my kid is having like a panic attack or something like that. It could be nicotine overdose. the rapid heart rate, the nausea, the elevated blood pressure, the vomiting, the diarrhea, the dizziness, and then the extreme effects of nicotine overdose, you'll have seizures and you could have death. So it's a very potent substance that we mustn't trivialize or minimize or anything like that. And one of the biggest marketing gimmicks that the vaping industry is doing is it's water vapor, it's harmless. It is not harmless because the e-cigarette aerosol uses breath from the device and exhale, and they've got harmful substances, which are these ultrafine particles that are actually inhaled very deep into the lungs. And they have flavorings that are linked to serious heart lung disease. There are volatile organic compounds in there. There's cancer-causing chemicals and nickel, tin, and lead. There's lead. They're absorbing lead into their lungs. So we need to know that it's not harmless water vapor. That's how they present it. Um, and they actually also expose the people around them to the harmful vapor. So, we had the whole piece about secondhand smoke, but the same thing, there is same impact on folks that are around people that are vaping. So we know that the cycle of addiction is there's an emotional trigger that sets off that craving. Then you have like a ritual of, lighting up the cigarette or pulling out your vape, and then you use, and then you feel immediate guilt after that. And then that just sets you back into the emotional trigger and the craving and then the ritual and the using. So that's our cycle of addiction that we want to break our kiddos away from, because I think we can do that. So we know that most of us know that addictions, it's very research based, that addictions tend to start in adolescence. And one of the biggest reasons why addictions start in adolescence is because the adolescent brain has a lot of gray material in white material. Us mature brains have more of what we call gray material. White matter means that they absorb things and they learn things very quickly. That's why social media contagion and teens can really imitate very quickly, and they can learn things really fast and memorize things very fast because there's a lot of white matter in the brain. When you have more white matter in the brain and you give the brain some kind of a dopamine kick, so they get a dopamine hit, a teen brain produces twice the amount of dopamine that an adult brain would. So, for example, a teen and an adult go down a roller coaster ride. The teen brain is going to experience a higher high than the adult brain. And so the reason why teen brains are more prone to addictions is they're getting twice the amount of dopamine in the brain, and then they want more of it. So they instantly want more of it. So if we can hold those risky behaviors at bay a little bit until the kids are 19, 20, 21, the more delay they can do. You can say, hey, baby, if you want to vape, by all means, mess up your lungs and go vape if you want to do that. However, if you hold off until age 19, here are some rewards mama is going to line up for you or dad's going to line up for you. So there's definitely, I am never opposed to doing all kinds of bribery with your kids to allow them to be able to delay. Now there's, yes, you will be getting this PowerPoint. Absolutely. Yes, I will send you this PowerPoint for sure. So first, marijuana use is in that age between 12 to 17, 67%. Okay. Starts very, very young. So we just want to be aware that that teen brain is primed for that. So for some signs of nicotine addiction are cravings, a feeling, a need, the need to use tobacco, going out of your way to get the tobacco, doing whatever you can to go out of your way to get the tobacco. And then feeling anxious or irritable. So like your vapes run out and you just are pacing because you don't have any more nicotine. So imagine you have a teen that's not driving and they've used up their vape pen completely and they're going through withdrawals now at this point. So imagine that irritable teen that you're going to have on your hands, and they may say all kinds of things about why they're so irritable, but it could be that they've run out of their vape pen. And And then the kids who cannot vape when they're in school, they go through tremendous withdrawals and irritability and aggression and anger. And then another definition of addiction is compulsive use of that drug despite the negative consequences. So I'm always talking about that piece about, are there negative consequences that have come up, but yet you continue to want to use it, right? So I want all of us to really regard addictions are not diseases of willpower. We need to throw that out the door. They're really diseases that occur in the brain as a result of how the brain gets hijacked by these dopamine hits that it gets. Okay, so addictions are characterized by compulsive behavior, continued use of that drug despite multiple privileges being taken away. So if you have a child who you have caught vaping, maybe once or twice or something like that, but if you continue to find your child, if you continue to catch them vaping and they're not able to get away from that, that you know that they're getting all these negative consequences. You've grounded them, you've taken social privileges away, you've done this, you've done that, but they continue to vape, then you're looking at a behavioral addiction that has popped in there, right? And there are changes that occur in the brain with addictions that we want to keep an eye on. Cheeseburger dopamine index, okay? Drugs cause an excessive spike in dopamine. Cheeseburger 1.5, sex 2.0, nicotine 2.0, guys, okay? Cocaine 4.0. So just look at how high that is right there. So we want to see really what's going on with that. So again, there's tolerance, and then you're going to have, they'll have struggles concentrating, they'll be craving nicotine, they'll want to keep it, nicotine products around them, they'll be craving more, and tolerance tends, that's why, cigarette smoking, over decades, we've seen that people who are cigarette smokers have the hardest time quitting because the tolerance develops very quickly and the withdrawal is extremely fast. It's one of those rapid acting drugs. So effect of prolonged use is that tolerance. You need to dose more frequently. You will let go of everything else, but you need to get your hit. And then the cravings can cause impairment in judgment. Kids will not think twice before they steal the credit card out of mom's wallet so that they can order some and have it delivered someplace or something like that. And kids will have that on, they'll have their providers of who gets them the vape pens. And the kids who are selling vape pens on school campuses are making big bucks, big bucks. So initially, nicotine begins as a choice, right? But what we've seen is that physical changes in areas of the brain that are critical to judgment, decision-making, learning, memory, behavior control. A lot of like our frontal lobe is what starts to change when we have continued usage of nicotine. And the factors that tend to contribute to addictions often will be stress, will have trauma, early physical or sexual abuse, or kids have witnessed some kind of violence, or peers who use drugs, and the availability. And unfortunately, the vape pens are too easily available. And I think it's very important for us to take a look at academic stress that drives many of our kids to vaping behaviors, right? So we really, there's too many behaviors that are available as a result of the screens. There's got pornography available, gaming, vaping, cannabis, eating disorders, alcohol, drugs are some of the responses that I see in my practice that are a response to overload with academics. So I'm a big one to say, talk to your kids. They do not need to do all these APs that we put so much pressure on them to do, even if all their peers are doing all the APs. Because what will happen is if your teen brain is not a stressed brain, they're less likely to go to vaping or cannabis or an eating disorder. So we as the parents need to be the ones that say, I'm only going to allow you to take 2 APs in junior year. Oh my God, mom, that's like academic suicide. How can I only take 2 APs? It's going to be horrible. I'll not get to where I need to get to. So your kids will push back a lot, but you're the parent and you're in charge of creating protective factors for their brains. And one of the biggest protective factors is not to put too much academic pressure on your kids. And yes, many of us have kids who are super bright and who tend to do well with getting really stimulated. And some of our kids will get bored if they don't have enough stimulation. So you as a parent kind of have to listen to your gut and not listen to what your kid says about all the people around them that are taking all these APs, and I'll be so left behind and I won't get into any college. And I really want parents to start looking at the value that we have in junior colleges. The professors who teach in JCs are professors who really, really want to teach. They don't have all these grants like UCSD. Majority of the professors have like grants that they're responsible for. So they're really not interested in teaching. It's really the TAs who do the teaching. And many of our big universities, so unfortunately, when we live in communities where we put so much academic pressure on our kids, then they start to think there's only 8 or 10 big universities that I should be thinking about and getting into. And I'm a big one for saying, hey, go to a JC because you will learn so many good things in your JC that they need to be able to learn, right? And then I think we also need to look at what we're doing for our neurodivergent kids and are we giving them enough support? Because for some of our neurodivergent kids, and when I say neurodivergent, I'm talking about people that may be on the spectrum, but people who also have ADHD, because those are the kids that need more support. And are we giving enough support to those kids? We really want to be thinking about that. So now I want to talk a little bit about how critical it is that we can have discussions with our kiddos where we come. Please don't give them the lecture about how vaping is so bad for you. Don't even go there. Okay, please do not go there. Talk to them from a brain-based perspective. Speak to them about the impact of nicotine on the brain, how it damages their frontal lobe, and the way it affects the pruning of the brain, and that that nicotine stunts the growth of your brain, baby. So we know that young people who use e-cigs are 3 times more likely to use cannabis. And you can talk to your teen about that. That I know that you're just vaping right now, but it's highly likely that it's going to move you towards the cannabis as well. And that what the nicotine is doing, it's kind of priming your brain for other addictions. And let's talk about what can we do to delay. And most kids, and when you have a nice open-ended conversation with your kid, you'll be able to say, so when you take that hit and then you feel like you need to have the next hit, what is it that makes you want to have that next hit? So have like a discussion about that so that they can understand. And then if it's addiction, it's very important that we treat the addiction, not the behavior, because that means with the addiction, there's a lot of underlying issues that are going on, and we need to treat those ones, right? So majority of my piece about the medication piece right now, but I think that with vaping, one of the things that's the most successful with vaping is hypnotherapy. And most families don't even know about that. So I've got some names, good resources for us of hypnotherapists that I'm going to give. It is very appropriate and very okay. And you do it in conjunction with your child's pediatrician, that you put them, or their doctor, that they can be for adults, like people that are 21 and older. I think it's very important to put them on a patch or a gum or do some of the medical nicotine replacement therapies. For our younger teens, I believe that if we get them ready to want to, they just have to have a tiny, even 2% part of them. If the 2% part of them wants to quit, hypnotherapy is going to be extremely effective for those kids. And it's usually one session of hypnotherapy. So it's very important that you know that there is help available. There's hope. When I think about parents of younger kids, so my goal is for my 5th and 6th grader parents to start talking to their kids about vaping. So if you have a child that's in 7th grade right now, it's already too late. You should have been talking to them. You ought to have been talking to them about vaping like last year or the year before. Ideally, fifth grade is a really good time. And there's a resource that you'll have at the end of this webinar that's Catch My Breath. The toolkit is phenomenal because it gives you a lot of scenarios of things, actual conversations to have with your teens and what kinds of things. And we want to lay the foundation at a very, very young age and teach them a lot of refusal skills. And I'll go into some of those. It's very important we talk to our kiddos about managing stress, thing that tends to work very successfully. So one of the ways my son was finally able to quit is he did it in a group. 3 of them decided to quit together. So with your kids who may be vaping, if they can enlist the support of 2 other people and then they set a quit date, it really works for them to set a quit date and then doing all the preparation for that quit date and then decide that how they're going to deal with that. So there is a website that really helps with the skill sets, with a lot of that you'll have. And any kind of stress resilience we can do with our children. So you just say, baby, this is going to be like the toughest thing you're ever going to do in your life. What can we do? How can we support you? What can we do to prepare you to be able to quit? So making it a really important event in the family so that your child knows that they're not being shamed or they're not being ridiculed or they're not being put down, but we're saying, we believe you can quit. Because even if there's a 2% part of you that wants to quit, that's okay. Let's do all the things we can do in order to get you to that place. The one that I've highlighted in yellow, if they text Ditch Vape to that number, they will get 24/7 support for them at any given time in their quitting journey. And the people who give them the 24/7 support are other vapors who have quit, and they know exactly how to respond to those texts. And there's a parent support line that I want my parents to be a part of and text there too, because the parent support group gives you ways in which you can support your teen and not take it away from them so that it becomes their journey and they can remain with it as their journey, right? So this is like, out of all the resources that I found truthinitiative.org as one of the best resources. They have 500K people enrolled in their program, and they have a 40% quit rate, which is huge. Now, all 3 of my hypnotherapists that I spoke to said that they tend to have a 90% quit rate with hypnotherapy with smokers. And all of the people the names that I have in my thing, I have names and phone numbers for the people. They've all worked with teens with vaping and have been very successful for them. So I want you all to know that there are practitioners here that are seasoned, that know what to do, and that will guide your teen to get through that. And it's very important that when we set up consequences, because remember, we have to present what our family values are about vaping. We've got to talk about what our values are. We want to really create a supportive environment for them. Tell them, see if they can quit with a buddy. We don't want to be judgmental in the process. We all need to be realistic and know that people who quit, like smokers, people who quit, they'll quit 3 or 4 times before they fully quit. So expect there to be some relapses, and don't have your emotions ride the roller coaster ride, because it needs to be their journey and through whatever resources they begin to lean on, in addition to you as the family member that's available to them. They want to be able to, I want them to be able to talk with you about the challenges they're having, cravings. They may go to a party one of the evenings and everybody in the room was vaping and they're like, oh my God, Mom, it was so hard. And then because they have that texting website, they can text that person. Even they're at the party, they can text that person, and it's anonymous, no cost, confidential, and the age range that uses this text system, age 13 to 24, very successful. So what we do here is we do neurofeedback here at my clinic at Healthy Within. So the way in that preparation stage, when they're setting their quit date and everything like that, what you can do is you can bring them in for some neurofeedback, because what we're going to do is we're going to calm that brain down, get the brain ready, because the brain is stressed and it's got a lot of anxiety. Get that brain ready, as because then when they have that quit date and they quit, they're going to be very grumpy and cranky, and that neurofeedback can really stabilize them. Uh, by the way, I want all of you to know the actual physical detox from the nicotine, the part where they want to throw up and they feel sick and they'll be shivering and all the detox, is 3 days. The rest of it is all the mental dependency that they've had. So the role of hypnotherapy is very successful. So I asked all of them, I'm like, well, majority of my teens will be dealing with, they will not want to quit. It's the parents that want them to come in for hypnotherapy. Will how will it be successful for them if they don't want to quit? And all of them talked about how even if your kid, there's a tiny part of them that wants to quit, they'll be able to like work with that subconscious mind and get them to get into a better place. And we want to have patience. Lots of love, lots of patience, guys. We've got to have a lot of patience with our kiddos. So these are my three folks: Diane Edwards, Dr. Nadia Sarvar. So Nadia is, I believe she was a pediatrician, and she's really moved into medical hypnosis. And then in my resources, I'm also giving you a link as to the difference between clinical medical hypnosis and hypnotherapy. Now, keep in mind, it's the hypnotherapy that's very effective with cessation of vaping. It doesn't have to be the medical hypnotherapy. So Dr. Nadia does more of that, where where you go under and all of that. Lynn Whitmire is another person, and I've had extensive conversations with them and vetted them out, and I like all three of these folks. The other thing I think that we want to do while we're helping them quit is teach them to create their own dopamine toolbox, because they're getting dopamine hits out of the vape. So we want to teach them to create protective behaviors towards their brains. So can they go and do, when they get an urge, can they go and do 30 jumping jacks? Can they go and call a friend and talk to them on the phone? Can they go swinging at the park that's near our house? Can they go, play some games or something like that? And if they do go to video games, I'm a big believer of like less than 20 minutes, 25 minutes, because otherwise they're getting the dope. Then they're transferring behaviors over to gaming. Important. I want you all to feel hope as you listen to this. And the hope is going to come from your patience, your perseverance, your calmness, and you not getting over invested. They need to start to get invested in wanting to stop the vaping. And what they show, that 90% of e-cigarette users who quit say that they feel less stressed. So what might end up happening is, if you have a kid who's vaping and they're in psychotherapy or any kind of treatment, once they stop vaping, they're not going to need that psychotherapy, because they're feeling less anxious and less stressed and less depressed. And my hypnotherapists are saying that they have a 90% success rate with nicotine. So I'm thrilled about that. And I am getting pretty clear about the fact that it's not necessary to use gum or patch, since their brain is so neuroplastic and their brain really makes that shift very nicely for them. And it's very important, as long as you all, as the parents, are being supportive, you're not being punitive, you're not riding their ass, you're being aware that it's going to be small baby steps at a time. And truly, I mean, I have this young lady of mine has been vaping since she's 13, and she's like 20 now. So she's been vaping for 7 years, right? So it's going to be small baby steps at a time. We want to be teaching them lots of stress management skills, lots of activities in real life, good time with their friends. Now, what's huge that I was not aware of, which I didn't even think about actually until I was preparing, is the amount of the e-cigarettes, the amount of toxic waste that we're creating with the e-cigarettes. And they've got some videos on their website that are about the impact that e-cigarettes have on the environment. So you might have a kid who's doing all of these projects in school about the impact of, climate change on our environment and everything like that. And then on the other hand, they may be vaping. So there's like, two different things going on with them. So that may be it's you go, hey babe, I found a really interesting a YouTube video about the impact that e-cigarettes are having on the environment. Would you like to watch it with me? And if they say no, back off. And they might be intrigued and they'll go look themselves and they'll go find it. If they say no, again, back off. Please, parents, you guys need to be the first person to talk with them about vaping. I do not want it to be their peer. I don't want it to be one of their social media influencers who they're following like crazy on Instagram. And then keep in mind that these are baby steps we're going to have towards quitting. And the open conversations need to start in 5th grade, 6th grade, middle school, and then make the expectations about how our family deals with vaping very clear. So the expectations have to be starting 5th grade. Sweetheart, we don't want you using tobacco or vaping e-cigarettes. Baby, in our family, we disapprove of teens vaping. It is not legal. No one in our family should smoke or vape. I am very proud of you for not using e-cigarettes. Mom and dad are very strict about the consequences we're going to give you if we find you vaping. You're going to lose time with friends. You're going to lose extracurriculars. You're going to lose screen time. You're going to lose social media. You're going to lose gaming time. So be very clear about what the expectations are and what the consequences are. And I'm pretty, I really encourage my parents to make sure that the consequences are immediate and they're very short term. And because if you make it too long term, we tend to lose our kiddos in the process, because then they lose the whole idea as to what the consequence was. I think it's very important that they learn, that we teach them refusal skills. So if they're at a party and people are vaping and you're uncomfortable and the pressure is really increasing, call me, I'll pick you up, no questions asked. This goes with weed, this goes with alcohol, anything that's happening, that's going on, that's illegal, that they're uncomfortable with. No way. Another one is no way. If somebody says, hey, come on, let's go smoke. No way. I'm not going to smoke. Coach would be really mad at me if I was caught using this stuff. So many of us have athletes, and in athletic teams will often find the boys will start and the girls will start influencing each other to vape, and then teach them the skill of, no, I'm not going to get into trouble just for that. No, thank you. I can't afford to get addicted to that junk. That stuff is really bad for you. So these are things you want to rehearse back and forth with your preteens and teens so that they get comfortable using this kind of language. Say the refusal skills. Basically, if somebody were to offer vaping to you, baby, how do you think you would refuse? What do you think you'd say? Okay. I'm a big believer that the consequences, the smaller they are, the better. Loss of phone for a week, loss of allowance for 1 month, limitation of social activities for 2 weeks. A big one that I like to do is write a paper on the dangers of e-cigs, because then the first site that's going to come up is Truth Initiative, and then they'll be in it. And then there's going to be all this cognitive dissonance that's going to occur for them, where they'll be vaping and then they're seeing this information about how bad it is for them. So there's this internal tug of war that's going to start to happen for them, which is exactly where you want your kid to be. You want them to create that internal tug of war, if that makes sense. And I think it's very important as parents when we catch them. I remember the first time I discovered all his paraphernalia in his room. I was livid. I was mad, took pictures of it, gave myself 48 hours before I was going to say anything because I wanted to be in a calm state. And calm, stern, mad, very disappointed, very disappointed. But that was the first time that he realized that he wanted to stop smoking. My reaction at the outset had been one of the reactions that got the first seed going in his mind about how he wanted to start smoking or stop smoking. So these are my resources, important resources for all of us. Catch My Breath, the difference between hypnosis and hypnotherapy, results for vaping. And this is my book that I'm like going on and on about right now for everybody to be aware of. It is fantastic. It's called The Anxious Generation. And what they're really talking about is the impact that phones are having on the mental health and the brain health of our kids. So it's a very good book, and we need to have that smartphone revolution. That's another topic I'd love to be able to do at another point. So I just really want to thank all of you for being present and being here and being in the room. And I guess what my biggest piece is going to be, if we remember our little ones when they were itty bitty and they put their hand in us and we just felt so protective over our children, that may we be blessed with the patience and the compassion to not give up on our teens and our children. And may we all have the courage to keep persevering. And may we all be blessed with a teen young adult who quits vaping, because that blessing, I kid you not, is a beautiful blessing to have when that occurs for you. So I'm happy to take any questions at this point and answer any questions and see if there's any pieces that show up for anybody.
I mean, I can start with just saying thank you for all that information. I mean, I didn't know how high the rates were for kids and teens vaping, but this is going to be really helpful. I'm going to also be sharing this information with my substance use specialist.
Yes,
He's barely starting, and this will be really awesome. I mean, we have
yes.
so many children and teens that we work with that come up with vaping, and parents having so many questions. So these resources that you provided are going
Yes.
to be great. So
The
thank
resources are very good. And I think what's really important, and it's so funny because I'm on the board of Crime Stoppers, and we have all the SROs on our school campuses. And one of the biggest things we come up with are all these vapes that, kids are vaping in the bathroom and the SROs get called in. So I was asking our detective, who is like one of our persons, and I said, Mark, do the SROs have this texting line that they can give the kids? Like the one thing we can give them would be that texting line, ditch vape on that texting line. And the SROs don't have any resources. So there's a lot of, and in fact, I did a presentation with all the Poway Unified School District counselors. I think there were like 97 of them, and they none of them knew about this vaping text line that the kids can sign up on. So there's a lot of resources available. The San Diego County of Education also has one person that's dedicated to be able to come to schools and do presentations about anti-vaping. But I think to me, a very big part is the parents having this open-ended conversation, the kids saying, and remember a hypnotherapy session, one hypnotherapy session, because they create a tape for you that you listen to every day for like 21 days. They want you to do that. One hypnotherapy session. You probably might spend, I don't know, I should have asked them the costs, maybe like say $200 or $175. Kids who are vaping are spending an average of who are addicted are spending an average of $800 to $1,000 a month on vaping. It's huge. It's huge what they spend. So when we look at the investment of a $200 session that we spend to do a hypnotherapy session, and then you follow up and you listen to your tape, but right away in the subconscious mind, you've got that planted. And then we have, you join a gym. If you're working with an adult who's vaping, they join a gym and they go work out. So all the money that they're spending on their vaping, if they just tabulate it, well, that'll be, if you have an adult child who's vaping, one of the things you can say, hey babe, I'm not going to like lecture you. I'm not going to uh scold you or shame you or anything like that. But have you ever tabulated how much you might be spending on vaping? That could be a way we could just start a conversation with them. And I don't have a judgment about what you're spending on vaping, but have you ever tabulated that? That could be a good thing. So great, wonderful. I'm glad. I think there's a question in the chat line there. Yeah, no worries, no worries. Yeah. Okay, good. Anybody else with any questions? Otherwise, we could wrap up in a couple minutes. Leslie?
I recently heard something, and I can't remember online. It was somebody talking about how nicotine the tobacco wasn't a it wasn't the tobacco that was addictive. And so early on, when they started manufacturing the cigarettes, they started adding chemicals in there to make it really addictive. And I didn't know what was in those vaping, but I suspected that there was a lot of really gnarly, nasty chemicals.
There are.
So that
Yeah.
was really interesting to see
Yes.
you list what was actually in there because, as you said, like, I mean, I guess I've never bought one, and I suspect, as you said, that on the packaging, it's not telling you what you're ingesting.
Right.
And
And the packaging oftentimes is very deceptive, Leslie. The packaging is very deceptive. They do not say exactly everything that they get away with not reporting everything that's on the packaging. This industry is so unregulated right now.
yeah, it's
It's
corrupt.
so unregulated. So basically, the tobacco industry just morphed into the vaping industry. And the only regulation that we have in the state of California right now is that they're not allowed to sell the flavored products to minors or something like that anymore. Now, there's like the tiniest bit of regulation because a whole new industry came in and it's not regulated at all. So whatever they don't even have to report everything that's in the actual vape pen.
Mm-hmm.
It's insane.
Yeah, crazy.
Yeah, but I appreciate all of you being here and thank you so much. And I hope this was valuable. And if there's any additional questions I can answer for any of you, please know that you can reach out to me. Let me put my slide that's here that has my email on it. It's drkakaya@healthywithin.com. And it was delightful to have all of you here. All right, take care. Bye-bye.
Bye.
Okay, bye.